Right, now we're going to look at the unconscious patient, the patient who's collapsed, okay, first of all, and we need to follow what we call the doctor's ABC principle. So first of all, check for any danger, if there's any obvious danger about. Obviously at the moment there are things like the COVID danger, which we're going to talk about later on, but for now, see any obvious dangers about. If there's no danger, we can approach the patient, check to see if there's any response. Hello, can you hear me? Hello? Shake and shout to see if there's any response. If there's no response, at this point we shout for help. Help! Help! And try and get some attention. If you've got other people there with you, then obviously you can ask them to come and help you anyway. Right, after checking for, shouting for help, we now need to check the airway. And to do that, we need to put one hand on the forehead, 2 fingers under the chin, and bring your head right the way back, okay, as far as it can go, and that will clear hopefully the tongue from the back of the throat. Once we've done that, we now, with the head in that position, we need to check, are they breathing? I'm checking if the patient is breathing by listening, with my head next to their head, feeling with my cheek against their breathing, and looking down to the lower part of their chest to see if there's any signs of movement. Now normally, you take about 10 seconds to check, and in 10 seconds, a person would normally breathe at rest 2 or 3 times, because they normally would breathe at rest about 12 to 20 times a minute. Now, if they're not breathing at all, or taking gasps, or what is often known as agonal breathing, then we have to do CPR on the patient. We need to get somebody to go and call 999 for the ambulance. If you're by yourself, you have to do that yourself now, okay? If there's nobody about, you have to make that call either with your mobile or have to go to where the nearest phone is to make that vital call to the ambulance service. And of course, in doing so, you're not only going to get the ambulance service, but you can also ask them to make sure if there's a defibrillator as well. So what we're going to do is now get the patient on the floor. And to do that, we can't do this on a chair, we can't do it actually in a bed or like that, so we have to physically get the person on the floor by either rolling them onto the floor and supporting them on their back. Once they're on their back, on the floor, what we now need to do is to kneel next to the patient, and we're going to put the heel of our hand on the centre of their chest, just there. Basically, the nipples are a pretty good indication that it's the centre of the chest there, so that's where the heel of the hand goes. The other hand intertwines with the fingers over that, and you now need to come up on your haunches, and your arms need to be straight. We're now going to press down, okay, at this rate. 1, 2, 3, 17, 18, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. After 30 compressions, we're now going to do 2 breaths for the patient. Again, get the patient's head back, as it was before. Put your mouth completely around the patient's mouth and block off the nose. You can either block it off with your fingers, or I tend to use my cheek like this. After 2 inflations, we go back to the chest and we press down again as before, doing another 30 compressions. And as you see, as we're pressing down on the chest, you can see the red line, which is indicating the blood is going from the heart, being pushed up by you to the brain, lighting up the brain. So that's where the blood, and therefore the oxygen, is being taken to the brain. And we carry on repeating that, 30 compressions and 2 inflations till the ambulance arrives or the patient shows signs of recovery. Now, I said at the beginning about dangers, and of course with the COVID crisis we have at the moment, the main danger is obviously infection to yourself. So with the COVID crisis, we need to be aware of minimising the contact with the patient. And the first thing we need to be aware of is actually that we need to be able to shake the patient and see if there's any response. Okay? You can do this, first of all, by putting a cloth or something like this over the patient's mouth, which will actually minimise the risk to you. So see if there's any signs of life in the patient who's collapsed. Hello, can you hear me? Can you hear me? If there's no obvious signs of life and there's obviously no response whatsoever, okay, we now need to do shout. So it's shake and shout is the first two things we need to do after the initial approach for danger. The next thing we need to consider is to call, if there's no response at all from the patient, to call 999 for the ambulance, and also to ask for somebody to go for the AED. Now the AED, if the ambulance service, when somebody makes a call for the ambulance, they will tell you where the nearest AED is. And a little bit more about that later on, okay? The next thing we need to consider is do not put your face next to the patient's face, okay? So by putting a cover over them, that will actually help to minimise the risk of that. And finally, to start CPR on a patient who is not responding at all. If they suddenly do respond, then obviously stop doing CPR, and you may well, if they're breathing normally, you put them in the recovery position. But if there's no signs of any life at all, you carry on doing CPR until the ambulance arrives.